So we are winding down our sessions in reflexology for the next 3 weeks that we have left. We'll be focusing on the practical side of the course, as we have spent some 9 weeks looking at the systems of the body. And now we're going to look at how we go into each session and how we treat each patient in a sequence. So we'd have sent videos out after each system, so you can get to learn to focus on a system at a time. Even though in a session, we don't just focus on one system, we do a full body during each session. But the best way to learn was to look at it system by system and to practice. So next week, you will need to bring someone to the room via video. You need to send in a video of you treating someone based on the videos that you would have gotten, following the steps that were used. So as we recap in the session, the immune system, we're going to look where in the feet we find the reflex points that connects to the immune, or we say lymphatic immune system, because we know that both systems work together. So if you look on this chart, you only see the word immune system, but we know that there's a lymphatic immune system, and these two systems work hand in hand as the police of your body that helps to fight off viruses and to build your resistance against different flus and stuff like that, right? Then you have the nervous system. And we can see on the chart that the nervous system, it's connected throughout your entire body, but your spine plays a great role, as each point in the feet connects to a different part in the spine, whether the lumbar, the thoracic, or the cervical spine. And so you will see how when you touch a particular area, and charts will come to you to see exactly how it flows from one part of the foot into the organs of the body. So just like how we see this chart, and we see the nervous system here, so it is that when you press the feet based on the referral area up here, you will notice that you are stimulating these parts of the body based on where you are in the feet. You'll notice sometimes that clients will tell you that when you press the point that is near to their heart in the spine reflex, they either feel an electrical impulse there, or depends on where you are. So it tells you that the system connects. Then we see the musculoskeletal system. So what happens, you'll notice that some of the systems, they are joining because the muscles and the skeletal system, they need each other to function, right? And so you know that in order for bone to move, ligaments and tendons are connected to the system, skeletal system, and also to the muscle system, all right? Then we see the excretory system. And so we looked on that in detail, and we know exactly that persons will come with different issues, constipation, and all of that. And you're going to learn today in one of the videos how to treat patients or how to help patients who are having these bowel issues. All right, remember now you have the gland system, which is the endocrine system. All the glands of your body are connected to that system. Then you have the reproductive system, male and female. You have the respiratory system, and you know that in the respiratory system, based on the foot chart that we're going to look at, you have the lungs, you have the bronchi, and you have all the diaphragm. These are the areas that you stimulate to help patients to have a ease. And some of the cases that will come to you, they will come to you with a respiratory issue, but you'll be able to flow accordingly. As we go through the next 3 weeks, we're going to look at the different method, whether we hook, we press, we walk, different methods as to how we get into the different reflex of the body. We have the integumentary system, which is the skin, and the skin is the largest organ of the body. And also the skin is a mirror of the liver. So sometimes when there's something happening in the liver, the skin will show whether sometimes it's an acne, sometimes it's a liver spot, different things, but the skin speaks. Then you have the cardiovascular system or the circulatory system, which, you know, is the heart, the veins, the arteries, right? And then the digestive system, and that system is the stomach, the large, small intestine. And you know, the digestive system is from the mouth to the anus. So this is just a review, and always try to remember each time what system does what. So this chart will ever be before you, the right and left foot of the reflexology chart. You will always need to have this chart before you, especially when your clients come to you. You have the chart on a stand, or you can hand them in a laminated form, and you say to them, this chart is a referral area to every nerve in your body. It tells where it's connected to in the feet, and through stimulation, I'm able to increase circulation, detox the body, bring about some form of relaxation. And so we're going to be doing the sequence today in brief, so you can see which part connects to what and some of the steps that will be used. So this is just a master chart, but I'm going to break it up now into the toes so you can understand what we look for in the toes. So in the toes, if we go back to this one a bit, we'd have missed a little on the small toe. We see the brain is on the top. Then we have the sinus just below, then the ear, then the upper and lower teeth, then the inner ear, right? We see that sign at the inner ear goes all the way over right here. So when we move to the next chart now, we're gonna now focus. Basically, we're looking at the brain. So for the brain, the client feet are before you, whether in a chair, in a bed, and this is like you sitting before the feet of the client. So the left feet is on your right, and the right foot is on your left. So you'd have zoned the feet, and you're now at the brain. So you walk the top of the toes 3 times one way, 3 times the next way. But while you're walking, you're also feeling if there's any grain, if there's any hard area, if the client have any pain, and you're communicating with the client. And you will do that for all the toes, a walking method, all right? And then when you reach the pineal or the pineal gland, which is like 1/3 down the big toe, you will go there and you will do a press or a hook. So you can either use your right hand to press into that area 1, 2, 3 times, or you can maneuver if your left hand is strong enough and go to that spot and press that area. And so this is the area where patients having sleep issues, that once you stimulate that area, it helps the body to release its own sleeping hormones, right? And you have your endocrine slides. You will continue to read each slide to understand the system. So remember, we break it up into systems, and then we also know breaking it up as to what we find in each part of the feet. So we have the eye reflexes. So we say in toe 2 and 3, at the midpoint is the eye reflex, but remember the sinus points are found the same place in all the toes. Right below the top of the toes is a sinus reflex. And for that, you press with the big finger 3 times, or you can hook. The best way you can manage to hold the feet, and you press into it, and it will help to release the pressure that many people have during when their sinus is very active. So let's go back to the big toe a bit. Right below the sinus reflex point on the big toe, it's the pituitary gland. This is a master gland of the body. This is where the hormones, like a pharmacy, is released and is sent throughout the body. When you take medication, it's the pituitary gland that responds to the chemical that you take and know exactly where in the body needs what. Then you have like a ruler right alongside the pituitary gland. You walk that area is the hypothalamus. It helps with balance, and it helps when a child has fever. It helps to stimulate and allow the body to bring the body into a cooler temperature. However, remember, fever has its place. During a fever, the body is fighting, so the immune system is getting stronger. So fever has an advantage, all right? And then we see on the outer part, we call it the medial part of the feet, we'll find the nose and the mouth reflex points. And this is key because persons with sinus issues, sometimes when persons cannot breathe or cannot smell, you can stimulate that reflex point to help the client when the sinus is very active, all right? So remember, we have the body systems, and we have the glands, we have the thyroid, which is right here at the throat, we have the liver, we have the stomach, we have the pancreas, we have the intestines, we have the reproductive system. For male and female, we have the urinary system, we have the adrenal and the kidneys, and we have the lungs. So remember these systems, all right? So now we come down from the toes to the shoulder. So right along here, we classify here as the shoulder ridge. So right below the small toe, walking across here is the shoulder ridge. But also in the base of the big toe, it's the thyroid and the parathyroid gland. So the thyroid is nearer to the middle of the feet, which is this side. When I say middle, I mean the medial side of the feet, and the parathyroid is a little out. And so these also control, these are hormone related glands that help the body. So if you notice that some persons have a larger throat, we'll say they have thyroid imbalance, and this can throw off the kidneys. This can throw off so many different things in the body of the client. And especially when the client is very stressed, their thyroid hormones can get very high. All right. We look at the heart. So zooming in to the heart reflexes. So this is the outer part of the foot. The big toe is right above here. And so right in this fat pad of the foot is the heart reflex, right? So right along here is the heart reflex. And for this, you walk it up, find 3 rows, you walk it up 3 times, and you walk it 3 times, 3 times, 3 times across. If your hand is big enough, you can make 1 walk across 3 times. And then the same thing that will happen when you move over to the other foot. You walk across, you walk horizontal, and you walk vertical. And you're feeling people with high blood pressure and other heart issues. It's amazing. You feel little small stones, you feel grains, you feel harder rock. Sometimes it feels like you're kneading a dough. And 10 out of 10, when you feel these things, this client is a heart patient or have heart issues that they have not yet discovered. So it is very key that you're not just walking, but you're feeling. Then we go now to the lung diaphragm bronchi. So just where the heart is, remember the heart and the lungs in the human body are resting side by side. So you see right along here is the bronchi. So you walk a further distance up from the diaphragm all the way up to the base of the toe for the bronchi on both sides, right? So you're walking, so you're trying to picture in your head, okay, I do the toes, after I do the toes, I do the shoulder ridge, I do the heart, I'm gonna now work on the lungs. So you move over now and you walk up this area, 1, 2, 3, 4, and walk across. You do the steps 3 times each. So same thing for a person with respiratory issues. Sometimes the area is very hard. Sometimes you feel as if when you look at the feet, it looks so much yellow, almost like you're seeing mucus. And 10 out of 10, the patient sometimes is having a respiratory issue, they're asthmatic, or they have bronchitis, they have some respiratory illness. Reflexology works. All right? Along between the bronchi and the lung, there's a small tract right here, which is the esophagus, right? And just below it is the thymus. The thymus is a part of the immune system. So we use a big finger and we hook in 3 times because this helps the body to release powerful T cells to help fight off infections. All right, we move down a little further to the liver gallbladder. And so if you notice, you only see the right foot because you only have one liver and a gallbladder. So it is just below the diaphragm. And when we work in the diaphragm, we'd walk the diaphragm 1, 2, 3. Walk the diaphragm 3 times back and forth. And then at the center point of the diaphragm, you do a hook into the solar plexus. Millions of nerve endings are right in this area, and it helps to release stress from the client. So for the liver, we walk in, we walk into the liver, we walk in, and then we walk up. And then we go now and we look for the gallbladder right in the midpoint, and we do a hook in that area. I'm telling you, I've had cases where after working the liver of patients, they had to be admitted in the hospital based on what I felt. And the test came back, whether it was a liver issue or a gallbladder issue. And I remember one case when I told the family that they need to take this woman in the emergency room. And the woman said it was Christmas and she would wait until after Christmas. And she did not make it because there was so much imbalance in the liver and the gallbladder. She died a couple of days before Christmas. All right? So be sensitive to what you're feeling and encourage your patients to go see whether their doctor or the specialist. So you will now study which doctor focus on the liver, which doctor focus on the kidneys, which doctor focus on the bladder, which doctor focus on the reproductive system. And you can say, you need to go see one of these specialists, all right? Then you have the stomach pancreas. So people who are diabetic, people who have a lot of gas bubbles, this is an amazing one when you begin to work the stomach area. So you have the stomach, you work it on the right, 1, 2, 3, and you walk it up. And then you go over, when you reach over to the right foot, to the left foot rather, you do the same, you walk across. But one thing, remember now, with the liver, you only have one on this side, but with the stomach goes from right to left. And then there's a pancreas in the center line of the stomach that you're stimulating, especially for those who are diabetic. At the end of that line, I need to add the spleen. So you need to add the word spleen, and the spleen helps with the reproduction and the repairing of the red blood cells. And so you hook into that 1, 2, 3 times. Sickle cell clients, this is a good treatment for clients who have sickle cell. All right. So you walk the stomach. So we're going down. Then we reach to the kidney, adrenal, ureter, and the bladder. So now we have 2 kidneys. So we work the right one. We find the adrenal gland just below the diaphragm. We hook into it 1, 2, 3 times. And when the client is stressed, they normally make a lot of jump right here in the adrenal gland, right here. This blue spot along here. So I want you to take a client's feet and go in, use your chart, print a copy of the chart that is in your slide, and say this is that, or even to code it on the foot bottom. Get a pen or a pencil and code the foot bottom and learn how to find the different parts of the feet. Then you have the kidneys. So the same thing for the kidneys. You walk the kidneys 3 times, 3 times. Apply pressure, feel for hard areas, feel for rocky feeling. Sometimes there are kidney stones. You can pick up those imbalance by doing the kidney reflex. And then you now realize you see the ureters. You're walking down the ureters, all right? Because it's taking the fluid down to the bladder for it to exit the body. And when you go down to the bladder, on the outside of the medial area of the feet, you press 3 times and you will also feel for if there's any imbalance. We normally encourage the patients to empty their bladder before the session, because if they're having issues, sometimes they have to jump out of the chair because the body automatically begin to release, all right? And so looking at this chart as well, we could also notice that we are seeing the fallopian tubes and the uterus reflexes in the lower area of the feet. But we'll look at that on another chart, all right? So that is for the urinary system. The large intestine and small intestines, anus, rectum. So we'd picture this line right here, the appendix, very important part of the immune system. And we'll walk it. We'll walk up to the halfway of the feet. Walk up this area. Find halfway of the feet. When you reach here, you press here, press hepatic flexure, and then you walk across, all right? So you walk across here. You do that 3 times this way, 3 times this way, and you're feeling and you're pushing. You're using your big finger to push as you go to the area. Push, you're pushing, walking slowly, but you're applying a lot of pressure in the area, all right? You see the videos and you practice from the videos. You have the sciatic nerve point at the base of the feet, and this is very important for persons who are having sciatic issues. When we look over on the chart, we'll notice that there's also a point right here for sciatic nerve. People who have a lot of nerve issues, it will show up here. So we also go to the anus rectum reflex, which is the outer part, they call it the Achilles tendon. You'll use your index finger and your thumb and apply pressure, walking up this area, walking up the anus and rectum reflexes. And I'm telling you, clients with bowel issues, my God, this is something that some of them will cry because they think it's so painful, but then they'll get their release. And so you'll see, based on each part of the body and the view that we're showing you, we're zooming in to different parts. So when you're looking at the large intestine, small intestine, anus, rectum, and then look on the chart, you'll see the different parts of the large intestine, the appendix, ileocecal valve, ascending colon, the hepatic flexure, and the transverse colon. They make up the parts of the large intestine. When you go over on the right, you see crossover. It says splenic flexure because the spleen is right along that zone. Hepatic, the liver is right along that zone on the right. So we walk over to the left, and then we have the descending colon. We have the sigmoid flexure, and then we have the sigmoid colon. So you walk down and out. You're telling all excess, all backup to get out, right? You're helping the client's body, the nervous system, to help with the exit of excess waste. Then you have the spine reflexes, but I put the lumbar, thoracic, cervical because it's separated into 3 parts. The lumbar is along here. So you begin to walk, small walks, like just a small move of your thumb, and you're walking the lumbar spine. Now we're going to look at the spine in detail. And you notice you have 5 lumbar, and then you have the 12 thoracic, and then you have the 6, some say 7 cervical. So you walk them. And when you're walking here, it corresponds to organs in here. So when you're walking along here, it is sending signals within the systems of the body, all right? And so you walk the spine, you twist the spine, you apply pressure in the area, you walk across, you can do side to side thumb, you can hold the feet and twist, you can pressure going up. This helps to ease back issues for your clients, all right? Then we have the oviuterus, prostate, testes, the reproductive points. So right here, we find the uterus and the prostate reflex point on the inside. Okay, let me see if I can write along here. And then the ovaries and testes on the outer side. And then you walk across here, which is representing the fallopian tube. See it right here? You walk across. So do system by system and pick up every organ, every point on the foot chart that is a part of a system. So next week, we'll break it down. We'll use the same chart. When we say reproductive system, we'll pick up every point that you go to when you reach reproductive system, every point that you go to for each system, all right? Then we look at the lymphatic groin, lymph node, chest. So we put this chart up and we walk the areas, walking through the channels that represent the lymphatic drainage, and we're applying pressure to drain excess lymph out of the feet, all right? And then we, right between the toes as well, we apply pressure between the toes because we're stimulating the lymph nodes that are in the throat, all right? And that is very, very relaxing for the client. Even persons who have lumps, I have been able to work right along here in clients, and I felt lumps, and the medical test confirmed that they had lump in their breast. Hip knee joint. Right along here is a reflex point for the hip knee joint. So you walk up the triangle, walk it up, and you're feeling as you go up. All right. So we also have the upper arm and the leg, and we do that knuckle twist going up and down this area to help relax tensions in the upper arm and the leg. All right. And so these are some very important points that we need to look at as we continue our journey in reflexology. So let me go back to the system. So look, you have the lymphatic drainage on the, call this the dorsal view, which is on top, right? And on the dorsal view, you have the groin limb, the drainage points right here, press along here, the hip knee, right? The jaw, the chest, lymphatic drainage point, and person with tension in their neck, you can squeeze along here, and it helps to relax the body, all right? You also have the, along here, you have the sciatic nerve to help ease pain in the lower back or the hip. I have had patients who took, who stopped taking up to 6 months of medication after one treatment, one doctor in the British Virgin Islands. That was her testimony, right? And so you can also see the bladder on the outside of the, based on the chart, we were looking at the patient's feet was facing us. Now we are seeing the bladder from the side view, all right? We apply pressure. So remember now the anus rectum, big, the thumb and the index finger, we walk up the area, all right? This helps also with lower back issues right along here, all right? Medial, spine is along here, showing us the neck reflexes, the head and the brain, the anus, the rectum, uterus, all right? And the groin. We walk around the groin, we walk it with our thumb, we walk around. All right, we saw the colon, the intestines, we saw the markers for the waistline. We learned the different parts of the colon. I want you to pull each of these parts and study them by systems, study each point in the feet, get a paper, have all the names of the points that you go to for the toes, then the chest, then the stomach, abdomen upper, abdomen lower, the pelvic, and practice, all right? So we zoom in on the kidneys, and we're able to pressure point those areas, all right? So just keep looking on the chart and see how you can get to where they walk, you hook. So like for the solar plexus, we apply a hook pressure there. For the gallbladder, for the adrenal gland, we apply a hooking pressure there, right? For the bronchi, the heart, the lungs, the shoulder ridge, we walk those areas. We walk up, we walk across, right? And you can allow the client to take deep breath in and exhale as a form of relaxation, right? So remember now we also have the tonsils. Tonsils are along this area, and a lot of children need help in this area because they have swollen tonsils, and you can help find issues early before they can even talk, right? So we see the different systems of the body separating itself so we can see them from different views. The toes, very important. Spend a lot of time in the toes because it represents the brain. So spend a lot of time in that area. So ladies and gentlemen, it was my pleasure walking you through the different sequence of this course. But as we go week by week, we'll be looking at the practical side as to how we walk. We'll look at what you'll need for your practice. We'll look at your health records, making your health records. And so we are going into the practical era. So please respond to the questions that will come in your email. And then in week 12, there'll be a closing exam, simple exam. So please remember to study, study, study. This is the end of your class for today.